All right. My name's Dr. Christy. I'd just like to welcome you to today's ATI seminar. Thanks very much to Paladin for their support of the ATR seminar series. So today we're very pleased to have Flavia Robles, who's the Executive Director of the Northern Alberta branch of the Kidney Foundation, which has the mission of supporting excellent kidney health, optimal quality of life, and a cure for kidney disease. They develop programs, services, research opportunities, and awareness campaigns that have had a positive impact on millions of Canadians living with or at risk of developing kidney disease. Today, Flavia will be presenting Kidney One-on-One, a patient-driven peer support program which connects kidney patients with kidney transplant recipients, living kidney donors, dialysis patients, and caregivers. Team members serve as a resource by sharing personal and lived experiences in their transplant experience, kidney journey, and answering questions from a non-clinical perspective. So I'll let Flavia take it away.
Thank you so much, and thank you to the Alberta Transplant Institute for having me today, and for all of you for joining me. At the end, I will let you know that I will be joined by Daisy Escato, our kidney care manager, as well as one of our active Kidney One-on-One team members, Tracy Houstra. So for now, I will begin sharing my screen. So again, the area that we're responsible for is Northern Alberta and the Territories branch, so it includes Northwest Territories and Nunavut. And it is our Kidney One-on-One program. Today, you will be able to really get a sense of what it is, what we try to do and motivate, and the connections that we provide, and the reach out and the expansion that we're looking to be able to have in all units that we serve. I would like to just start off with a disclaimer, and also to express our extreme thanks and gratitude. So Dr. Amit Garg and Susan McKenzie and the Transplant Ambassador Program, that is a program and it's tied into research in TAP. It's called TAP, so the Transplant Ambassador Program out of Ontario. And our Kidney One-on-One program is adapted from that. Currently, it doesn't have a link to research, but it definitely could, because based, again, on the activities from the TAP program. So today you're going to really learn, what does it mean to be a Kidney One-on-One team member? What do we do as our role and the role, again, of the individuals? And this is interesting because it is the Kidney Foundation who we see as the support and providing the training and also the connection to Alberta Health Services and the importance and impact that it has on providing support, and also get those discussions going about the importance of organ donation. So again, what is Kidney One-on-One? It is elementally based on the philosophy that those living and have a direct experience can be able to share that and provide that most important connection to those that have been recently diagnosed, that are thinking about having a transplant, that don't even know about that. And so it is really working together to make those connections on a one-on-one basis and level. All the volunteers and the team members that are affiliated have their own shared journey and their experience. And so what makes this so powerful, and it is patient driven, is because they've been there. They know what is going on. We always refer to this as the not so easy chair. We know what dialysis does, and also the impact, especially when someone is newly diagnosed and it's like, what do you mean? My life has changed? How many treatments is it? And the ongoing impacts and effects that they have to be able to deal with, and who better to assist and listen than someone who has actually been there. So Kidney One-on-One is meant for those with chronic kidney disease, and also for the members and the family members, because we know care providers live and often act as the champions on so many levels to the patients and their loved ones that are going through it. And it's to provide that support group and also have those much important discussions about organ donation and transplantation. So our mission is really to support those. It's to be able to have those peer support connections, to have it being confidential and something that will provide a stability as they're really working through sometimes a quite complicated system and not knowing where they fit in, and knowing that they're not alone while they're doing that. So the goals of the Kidney 101 program, it really leads and it begins quite early for those meaningful interactions. We actually can't put a price tag on that to be able to have those connections to someone who has been there, who can be able, we talk about inspiration, encouragement, building, all of those supports to provide that compassion and that knowledge and that understanding and that often listening ears. These are the goals of the Kidney 101 program. We want it to be sustainable. We want it to grow. So for those that are actually today listening, if you see yourself potentially wanting to become a Kidney 101 team member, we're always looking to be able to grow and build on our current work as we want to be in every single unit that we operate out of, but also beyond now, obviously because of COVID, in a virtual environment. And so it is having those discussions and being able to build our support network to motivate those to have the supports that they need, to have that knowledge, and again, the more important discussions about organ donation. So who are Kidney 101 volunteers? It was interesting because, as you can see, there's a new the star beside volunteers being new. What we found is we wanted everyone to be having that support voice. So someone who's a living donor who's actually gone through it, someone who's a transplant recipient to know the benefit of what it's meant to them and their lives, those that are actually on dialysis and that are working through all of the red tape and the channels and seeing if they're even eligible, the caregivers, the care providers that provide so much knowledge and information and can really lend themselves to a great discussion with other care providers and those that are having to support their new loved one, friend, etc., who has actually been diagnosed with chronic kidney disease. So what we found was there was quite a few volunteers that came up to us who didn't have a direct connection. And they said, well, can we still be part of that program and then be able to provide that listening ear, provide the support information, excuse me, that we have as the Kidney Foundation for other programs that we be able to serve, and then link them up with an actual lived experience Kidney 101 team member from the various categories that you see there, from their very many faces of chronic kidney disease. So we definitely saw a place for that. So that's been a new thing that we're just introducing. And we're also monitoring that because our goal is to really connect someone. But we also know as they are meeting and reaching out to find that right person in their journey that they want to have a discussion with, then as they might have had that initial contact with someone who was a transplant recipient, but they want someone who has been a donor and gone through it, and then it gets matched up and worked accordingly. So we thought this would actually be an enhancement to the program. This is what our Kidney 101 team members wear. Now, this is pre-COVID. We actually worked probably 2 years to be able to be officially recognized from Alberta Health Services as a program that could go in-center into the units. The Kidney 101 team members go through our own training process, and then they actually go through AHS training process where they become officially recognized, but when they go in the units, they are active Kidney 101 team members, not part of AHS volunteer team members. So that's what led to that distinction. And we thought, again, you can see the back of them, ask me, I've been there. And someone knew who is a volunteer, it will say volunteer. So then to distinguish. And you'll see that we actually have imagine on the unit. So you stand out already, you're wearing these bright green vests. And the donor, someone who's actually been a donor, you can see it's a dotted, line. They're missing one. You only need one. So if anyone wants, consider living organ donation, a recipient, you can see how we've actually colored that in. It's like, yes, they've received, they have 3 now. And then someone who's actually on dialysis, who we know that can provide those added supports. And also the team members that we currently have are trying to push and seek out an organ transplant themselves. So very powerful to be able to have that. Confidentiality is key to our program. So obviously we all know we're in a pandemic. And so Kidney One-on-One has kind of shifted during this time because of not being able to go in center. We kept hearing from the Kidney Foundation, I wish I would have known about you and the supports that you provided earlier on. Like we didn't know. And so we knew if we tried, you put up a poster, you put up a brochure. Does anyone look at it? Does anyone see that? We do provide our Living with Kidney Disease binders to everyone that is newly diagnosed. But again, there's so much information coming at them. So with this program is for then us to physically, and meaning the patients to physically be in the units, you can't miss us, and we have those interactions. Right now, we're sort of back to relying on a bit of word of mouth and also getting our posters back out there, postcards, because we still can provide that support virtually, especially as, again, we have such a vast area. And so we are always cognizant that soon, hopefully soon, when it is safe to do so, that we come back into the in-center units. And we know they run morning and afternoon and evening and weekends. And so Kidney One-on-One team members then have transition shifts throughout it, but they always stay within the hospital setting when it's back in center for their own safety and to follow, to ensure like there's no liability for them or anyone else. So we always get this question. They do not give medical advice, but they do speak about their own personal journey. So everyone knows, and the training is provided, what is the distinction, and being able to really realize when they shouldn't be, it's like, no, you still need to go to talk to your nephrologist. You need to reach out back to your doctor. But again, they have had and gone through their own experience, so they can absolutely be talking about that, but not providing any form of medical advice to those that they're reaching out to. So we're always looking, again, when we're back in person, that they're actually, this is an official program. There's shifts. They have to be able to sign in. They wear their lanyards. It's something that is actually formal and recognized, which is actually very powerful. We're only the second program in Canada to have this. Like, again, the TAP program in Ontario, and we are the only ones, and we're here in Edmonton. There is no other, again, program like this that has had the authorization to go in center. So we also, again, make sure that our volunteers are safe and have those understanding of what they need to be able to do and how they can, of course, handle the situation that they're in and where they would need to go when a question is presented to them that they're not able to handle. Or so that's part of the AHS part of the training that a volunteer would have to go through. As well, every single Kidney One-on-One team member, there's a criminal records check, there's our training, and then the AHS training. So there's quite an extensive process. So at the end, they're actually comfortable and, to be able to have these interactions in a safe and meaningful environment. And we also know that, again, sometimes this is some experiences we wanted to also, share with, as they're going into the units. Sometimes the people are sleeping or they're having other things, and we just let people know that it's okay. And to have that added training to it as well. And so this is one of the things that makes our program as well different. And that is the shift reports that are so critical. This is where the metrics come in. This is what we're asking. It's the report that helps to identify concerns raised. It helps to provide the overall satisfaction or questions that got raised or follow-up that would be needed or more information. And so it's the tracking of what we're trying to do. So again, this is why the shift reports are so important. It's sort of interesting during our pandemic, just they've been reintroduced recently because it became more of like reaching out at this point and providing some general peer support, just like how are you doing? You know, I mean, obviously mental well-being is a big concern during this time. And so it became not as analytical per se as exact conversations that were being tracked, but those are coming back on because this is important. This is how we're able to see how someone can be able to become more comfortable in sharing their experience, their story, how we could have helped them more, what is missing, what is lacking, where else can we be able to support the person and, you know, they're really their caregivers through the journey to be able to identify not their concerns, but also look at those solutions and push for those improvements that we've been able to look at. So when we start the program, and they obviously Kidney One on One team members are not right away. It's like, hey, how are you doing? And this is who I am. And did you know about, you know, organ donation? But it is a process that we start very early on because we also know that so many times in center, which is, again, you're going into a hospital, is the first treatment that is ever offered to someone. And as they are just working out their own medical needs and, you know, getting used to what it means to be on dialysis, and usually the other treatment options are entered later on. And so we are trying to get those conversations earlier on. And also, there's been times, and there's obviously barriers that have been faced previously. Perhaps they weren't eligible at that time. Perhaps they would be now, and that conversation hadn't been revisited. So it starts with that. So to be able to track some of this information, that's how this reporting is able to also assist us to be able to move forward in a more meaningful way. So obviously, we're not going to be tracking. Confidentiality is critical, and so permission is provided always by the patient. And if they wish to remain anonymous, then we absolutely respect that, and we just capture the information that we can then share back. Again, with our advocacy efforts with the team, we had to meet with everybody, like all the renal units and the staff and the supervisor and the nephrologist. We let them know that we were going to be there. And I will, it's very wonderful because we've been welcomed with open arms. They know that this part of it needs to be there, more present and grown. And so this has been something that has been very beneficial. And it was sad, again, that we haven't been able to go in the units, but hopefully, again, when it's safe to do so, we will be back in there. So really, the Kidney 101 team members are providing inspiration. They're providing that level of support. They're providing that it's okay that they can be in a vulnerable position. And also they themselves, as they are meeting and having these discussions one-on-one, brings up their own experience. We talk about that and how Kidney 101 team members themselves have to be able to make sure that they're looked after. And so it becomes a very tight community of support. There is nothing as powerful as the patient voices that come unified and knowing that they're not alone in this, and that it's okay to have grief. It's okay to have anger. It's okay to have really quite a flurry of different emotions, because there is no one single face of what it means to have kidney disease. Everyone's community and experience and where they're at. And so that's what also makes this powerful. That's where the patients start driving Kidney 101 along with the team members to really facilitate and grow the support that is able to be offered. And so again, why are we pushing and starting to talk about transplantation very early in the conversation? We know this is an average cost of in-center dialysis of about $100,000 per year. And yet it drops by year 2 to $22,000. So when we look at that, that's the cost savings to our healthcare system. Our push is to the life and the improvement and quality of life that it does have for an individual. And so we know that by having those discussions, if it's possible, if they're eligible, because we 100% understand that not everyone will be eligible for a transplant. But that's only because of partly, there's obviously medical reasons. We don't get into their own particular. Again, that goes back to medical advice to their nephrologist. But if it's supply and demand, if we had and we're able to step up our donation and transplantation efforts, and then let us open those doors. We know that definitely for the living organ donor side of things, the wait is shorter. The workup can take, well, 6 to 9 months and up to a year for an average workup period to become a living organ donor. And yet if you're waiting for the deceased organ, it is 4.7 years in Alberta. Again, when someone is having to have their whole life change, or they're having to be able to travel many kilometers to be able to receive dialysis, which I like to call life support because that's what it means, where can we have those possibilities that perhaps that the living organ donation process is available for you? It really is the gold standard of transplantation. This is a slide from the Alberta organization group that I sit on, and it is the donors per million chart, comparing Alberta to the rest of well-performing jurisdictions. This is on the deceased side of things, and so we start looking at that and having that built-up awareness. As you can see, even within our own province, or sorry, in our own country, BC, Ontario, they're the best currently in the country. We'll see where Nova Scotia lands on here. This information is from 2018 for Alberta and 2020 for the rest of the well-performing jurisdictions. But Alberta, very sad at 16.2 donors per million individuals. So whenever possible, we encourage and be able to support those to talk about having a preemptive transplant. Now, we know that those are not, it is not the standard. It is not the first place that everyone, it's in center and you're working through that. But what if those discussions could happen a little bit earlier? Can we start building that awareness and to have that, to see as they're watching their GFR drop down, could they be eligible for a preemptive transplant? So we started looking. Of course, there's barriers to transplantation. Again, the lack of education, the lack of public awareness about living donor and also deceased kidney transplantation and all transplantation, the barriers that would be potentially incurred, and of course the healthcare system inefficiencies and the much needed changes that need to be able to happen to improve that, to be able to facilitate that. So one of the barriers that we took off right away was for the donor coming through our LODER program, the Living Organ Donor Expense Reimbursement Program. So it takes care of travel and accommodation and meals and loss of wages and childcare and parking. We don't want someone who is actually truly a superhero impacting someone's life. They don't have to have out-of-pocket expenses. They get reimbursed. It's up to $7,500, the full criteria. Daisy, who will join us at the end, manages this and it's for all of Alberta. We actually are the best program in Canada with the amount of level of support that we provide to donors. We're proud of that, and we're able to So the other barrier that patients have and individuals is they're like, I don't want to ask for I mean, it's easier for me to ask for, a recipe or anything. Like, I don't want to think about this. But we work and we help them. It's not about actually the ask. It's about the tell. And we call it the big tell. It's about actually letting people know that are having, you suffer from chronic kidney disease. Sadly, kidney disease has been living in the shadows for too long. You tell the general public, oh, I have kidney disease. Well, what does that mean? Oh, I have to go for treatment. Well, what does that mean? Oh, you mean you go a few times and you're done? It's like, actually, no, it is chronic. A lot of people, and it is 3 times a week. It is 4 and 5 hours per week, per day that I have to be able to do this. What? So it is honestly just getting kidney disease out of the shadow, getting comfortable. You won't have to be able to ask the patient, but that's where the care providers come in. That's where the friends and family come in. And that's where we, as the Kidney 101, we're the support system, but the Kidney 101 team members help with this. What would it mean? What can we be able to encourage? And so we get them. Let's start talking about it. It is so critical. We can't underestimate the value of just talking about it, raising public awareness, getting people to know that this is a discussion. We always say you live your life to the fullest and then you pass it on. That's for the deceased organ donation side. But what if you want to be a living superhero? Superheroes aren't born, we say they're registered. You talk about being able to have so many impacts that you can have. And as we remove the barriers and as we get these conversations out of the shadows, then it really does lead to that understanding. And that understanding then can lead to truly impacting someone's life. And so we help not just for them to get themselves to advocate, for their support system to be able to advocate. The Kidney 101 team members are there as a support system. And we at the Kidney Foundation are behind everything to be able to support. And we know when we need to step back, because there's nothing like someone who, again, has that lived experience and knows what it has meant. And so that's why we actually, again, it's the resources, it's the information, it's the materials. And as I've mentioned, we do know that there's more resources because not everyone currently is eligible to receive a transplant. If there is a medical reason why they can't, that is one thing. If they're not being able to receive one because of lack of numbers, well, that's a completely different conversation. And that's what we need to be able to push and change. And so in general, I won't get into too much details here, but this is what it would mean if someone wanted to become a living organ donor themselves. These are the tests required to be a living donor, and potentially these tests may be required if they need further information. One of the myths that is actually, oh, well, they'll just take my kidney, or they'll take my liver, or they'll take a lobe of my lung, because living donation is kidney, liver, and lung. And we reimburse, our LODA program is for all 3 of those organs for all of Alberta. So, and it gets run right out of here. So overall, Kidney 101 volunteers, they're not providing medical advice. They are speaking about their own experiences. They are actually listening more as well than they are sharing, and every information that is shared is confidential. We always, be able to train everybody. It's knowing those comfort levels. It's having that relationship, that key to be able to help someone on their journey. And we 100% know that a good and great conversation begins really by listening, understanding, and then the engagement, and then we push for those much needed changes that need to happen. And so we go over some of our training again. What does it mean, and what does listening actually involve? and also looking at those cues of body language. So that's all part of the training, some of that training that Kidney 101 volunteers go through, and to be able to recognize and identify. And so here are some of the members. I mean, these are real people. Like I just put some up. So Manuel is a transplant recipient. Tracy, who is here, she will be able to able to answer your questions. She's a living donor. Memory at the bottom. She's currently on home hemodialysis, looking to be able to get a living donor transplant. And Darren received, he's a transplant recipient. Again, receive and living full and well. And so these are people, real lives, real experiences, real connections, and real impact. Key principles of Kidney 101, and actually all of our programs, is every person we respect, and they have, and we honor their dignity and their worth. There's varying opinions. Absolutely. We encourage those. In fact, it leads to further discussions. It leads to further awareness. Once someone has that understanding and that knowledge, you can't go back. You use that, and knowing that you don't have to stand alone if it's going to be an uncomfortable discussion or something that you need to be able to, relate to or get a deeper level of understanding, and really at times pushing the system, not accepting something, asking the questions, knowing that we can be able to assist that, and the Kidney 101 team members help with that. And again, it's not about assigning any kind of blame. It's really about discussions and openness, because we know that we are everybody, the system included, is trying to help and make impacts. But we know there's always room for improvement, as there is. There needs to be more discussions about the importance of living and deceased organ donation. In general, Kidney 101 team members also learn about everything else that we as the Kidney Foundation offer. And did they even know? Someone can't get a transplant if their teeth are not healthy. So we break that barrier. We cover for their work to, have healthy teeth. Did they even know that? That could have been a potential barrier. We know how much dental, costs, and the thousands. And if that's a barrier, we are not going to make sure that that is a barrier. We tear that down. So in general, of course, providing our groceries, through our STF program, our short-term financial assistance, rent, utilities, medication, equipment, taxi chits, accommodation, gas cards. I mean, the list really goes on. And our program is constantly pushed. Our criteria is constantly pushed. And then that way, the Kidney 101 team members know about this as well, being able to access, and depending on where they are in their journey, they know that they can reach back to us in other forms of support. We work with the renal and to transplant social workers within AHS. So we know people are the ones that are going to make the changes. People are the most valuable resource that we have to be able to grow and learn from, depend on each other, and knowing that they're not alone and they can do this one-on-one. I'd also like to highlight our More Transplants efforts. Moretransplants.ca. This is on the deceased side. Everyone, it doesn't matter where they are and what is happening in their own health or what age they happen to be, we can all do something at the end. Like I said, live your life to the fullest and then pass it on. This is on the deceased side of things, of our activities. And so this information and any activities that we're running gets passed on to our Kidney 101 team members, so they know and they have that understanding that they can continue to share it with others. We are pushing for these changes for those that do not have a voice. For those, I have had so many patients tell me, I'm tired. I'm just getting through. Thank you for at least having this part that I can talk about, but don't ask me to be pushing for those system changes. And that's okay, because we will. And that's why we reach out to individuals and the public and everyone, because we have to stand up for these changes. And donor families are with us. They know the meaningful impact that organ donation has, and that the life of their loved one meant something, and the lives that can be changed and impacted. We are more powerful together. And so the messages of our campaign is really about saving lives, respecting the wishes of Albertans. And we know that Alberta can become a leader. We have tremendous resources. We have incredible researchers, nephrologists, transplant, organ donation teams. We need to be a leader. And this is something as well that I like to always highlight. When we're pushing for these system changes and we look at how valuable a life is when someone passes away and the impacts that it could lead for organ and tissue donation. This chart is a representation of annual deaths. So I removed, there's 100% of annual deaths. And if we actually break it right down, to even become eligible to be an organ donor is only 1.2% of annual deaths. When we look at that number and our deceased donors per million number, now you see we want to make sure that our system is working to the best of its capacity, to the best that it can offer for information, everything working together, that people are being asked, that are us as individuals that have signed up, that our wishes are honored and respected in the best possible way. And this is the preciousness, and this is the change that we've been pushing for. Well, everyone here should know Logan Boulet, who inspired hundreds of thousands of Canadians with the Logan Boulet effect. And it was his family that said, we know that Logan wanted to be an organ donor. The system, I mean, he didn't pass away here in Alberta. It was in Saskatchewan, but it's those critical conversations that need to be had, and we start them. Why not consider living? And then if not, all of us can do deceased, and having those conversations. And so please, we encourage you to add your voice to our More Transplants work, moretransplants.ca, full toolkit, what we need you to do, what else you could be doing. And it is all of us. You, in that way, even if you formally don't become a Kidney 101 team member or want to know more or get involved or need someone who can be there, you can add your voice to making change. And here's a quick, this is pre-COVID, I will let you know when we are running, but some of our team and volunteers that from our branch, I call ourselves a small and mighty team because we're not this many, but we have from the University of Alberta, a great active Kidney 101 club out of campus, which is wonderful. But we are behind you, and we look to be able to help and inspire everyone in all their journey as they live with chronic kidney disease and value the importance of organ and tissue donation. So thank you so much. And I'm going to have Daisy Escato share her, turn on her camera, as well as Tracy, in case there's questions. But I just wanted to thank everyone for being here today. And we're always here. We're always here, going to be here to be able to support everyone. So thank you.
Thank you very much, Flavia. That was fantastic. It's great to hear about all of these initiatives. I don't see any questions just yet, but one that I was wondering about, you had mentioned about the restrictions to in-person and in-unit that are hopefully going to be changing soon, but I'm interested to hear a little bit more about the transition to the virtual environment that you mentioned with COVID, because I think this could actually, potentially impact participation in a good way. There's lots of people who would be more tech savvy and interested in connecting that way rather than in person.
Yeah,
And
oh, absolutely. So when we get requests and we try again to get the word out through our various, like our e-news. So if you don't, please sign up to our Kidney e-news, but through our social media channels as well, through units and social workers. And then it's Daisy who actually starts connecting. And so maybe Daisy, you can start talk about the process from that, please.
Yes, thanks, Flavia. So, as Flavia mentioned earlier, my name is Daisy Escato, and I'm the Kidney Care Manager with the Kidney Foundation's Northern Alberta and the Territories branch. So, I do help oversee the Kidney One-on-One Peer Support Program here outside of our branch. And how the process looks now during COVID is I do receive the calls. So, the calls can either come in directly from the patient, they can come in from a caregiver or a family member or a friend, someone that just wants to learn about how this program works. Definitely, we always encourage that the patient reach out directly. I get to know them a little bit, just learn a little bit about their journey, chat about what type of support it is that they are looking for. And so, based on that, I let them know that we have a handful of really great volunteers. I go through a match process. And so, based on our volunteers, just their own personal kidney journeys and their experience, someone that seems that would be a good fit for this particular request, they get matched up. And so I help with the introduction. From there, the volunteer and the patient then take the conversation away. They schedule a time. It is happening over the telephone right now. So just taking into consideration that volunteers are not going into the hospital. And so they are connecting. It could be over the telephone, it could be over a Teams call, Zoom, Skype. It really is up to the patient and the volunteer and what works for them. And so once they connect, it's also all up in their hands in terms of if they want to keep connecting on a weekly basis, if they want to connect bi-weekly, monthly. Once that initial phone call takes place, I do follow up with the patient, just again, check in, see what their thoughts were in regards to the call. If they feel like they really had a great connection and they want to keep connecting with that one particular volunteer, that is an option. However, we also like to open it up because we have a great roster of different volunteers. So if they're looking to just learn about different experiences, hear from someone else, we then match them up with a different volunteer. So it really is about just building that sense of community, especially right now during COVID. We know that there is that big isolation factor. And so letting individuals know that they're not alone. And so it does look a little differently. And despite it not being in person, there has been great feedback because, again, patients are able to connect with individuals when they're off dialysis. So maybe they're feeling a little bit more better or they are feeling better at that moment. They're able to have a conversation on the weekend. Again, it doesn't all revolve around just what they're currently going through in terms of their kidney journey, but even if they want to check in with the holidays coming up or just talk about plans or more informal conversations, that's really nice. And so, again, the feedback has been quite positive, and we're always looking to just build awareness around this and the great value that it has for individuals. Thanks. And
Awesome. If Emily, RJ want to ask your question?
Yeah, thank you, Flavia. So good to see you again, and such a great presentation. And I guess, just an appropriate question. And I know I've asked this before, but I always like to check in and see what we can do. Basically, what support can the government of Alberta provide to assist with the success of the Kidney Foundation and help progress things, help contribute to your success as you move forward? And once again, thank you for your presentation, Flavia. Always is a pleasure to see you.
Thank you, RJ. And again, what a great question. It's like, what else can, Emily RJ Jurgensen is actually leading a private members bill to implement some of the changes that we've been pushing for organ donation. And I think that is critical. So through the More Transplants campaign effort, to be able to, add your voices and support RJ in his push to be able to really, we need that accountable structure to be able to happen. We need that public awareness to happen. That leadership will come from the government to be able to do that. And the trickle effect from that will be so powerful and life-changing to not just us at the Kidney Foundation, but every organ and tissue group that is out there. And more importantly, the patients that are waiting and the families that are waiting for this. By leading that charge, I think that would be incredible. Really, we are always looking to improve every program that we are able to offer. We know that there are barriers as well to reaching our Indigenous communities, and we're going to be tackling that on and being able to to work on that. And so perhaps I'll reach out to see about resources to be able to access our vast geography in a better way, in a more meaningful way, to have those one-on-one discussions with these very at-risk vulnerable groups. But thank you so much for all of that. And everyone, please, we're going to be out there supporting, and it is our voices that join together. We're going to be powerful together. We already are. We've seen it. And RJ is a champion for this. So thank you for that. I saw, so I just brought up my chat.
Yeah, I was just going to read that.
Dr. Schulte, it would be great. I would love to have a one-on-one discussion, no pun intended, with you, because we would love to partner up with when I know that there is new research being done right now, partly from various nephrologists involved, to be able to work early with someone who's newly diagnosed, for us to be part of that. And I haven't seen the TAP results yet either from the work from Dr. Amit Garg's. That's part of the CanSolve CKD research. I haven't seen that, but we actually are, we are able to reach out to them quite frequently. And like I said, for ours, we modeled it after. It could actually be visually tied into research if someone who's a researcher here is interested in taking this on, and we're open to tweaking anything that we could be doing. So right now, our successes have been based on the feedback that we've been receiving from those that we have helped. And so it has been a bit more informal, but the shift reports help with some of those metrics. And we do have everything in place that could become that. So I would love to become a formal early on, since we can't get into in-center, we're not sure when, but we could provide that link very early on with someone. And that would impact that person's life tremendously, because we've seen that time and time again.
Excellent. Anne, did you want to ask your question?
Sure. Thank you so much for this presentation. It was just excellent. I learned so much. I'm curious if there's sort of a, maybe this just happens anyway, but maybe in the process of bringing someone into your team as a one-on-one donor or recipient, you hear feedback that would be really valuable to the transplant program or to the living donor program. Do you have a way to provide that feedback or, constructive criticism perhaps to those programs so that they can work to address some of those potential barriers or things that were challenging? Is that something that you can do?
That is, and great question. All of you guys are wonderful. That's exactly what this program is about. And actually, so what we do is we compile that information that we've been receiving back. We also encourage those who've gone through any of our programs, whether it be the Kidney 101 or our low derp, and we compile, and then I actually take it right back to the supervisors of those programs, and we let them know. That is the point of this. Can we work together? I mean, I said that from the beginning, and you said it more eloquently than I did. It's constructive criticism, because we know that the system wants to do good things. They're trying to do their best, but they're also dealing with every day and just getting through there. We're able to step back and that most valuable patient perspective. So you thought it was working ABC, but actually no, C got dropped, and it's getting dropped a lot, something that needs to be looked at and considered. It's advocacy efforts that we see to push for these changes, and it's coming again from patient experiences lived, and so 100%. I think we could, we're trying to actually currently compile some of that from the living donor perspective, for those that have actually tried, and why is it taking so long, but it is constructive criticism. That is what it is, and where it was, what was the bottleneck, how can we make that a better experience? So yes is the answer. I'm very bad. I'm like, I speak too long, but I could have just said yes, right, Anne? But now you know.
No, I loved your answer. And I guess just like building on the question from MLA Sigurdsson, I think, the living donor process is super arduous in the sense of so many appointments that are during the day. And I don't know that everybody has protected sick time from employers to do this. And that sounds like legislation to me as an opportunity. So maybe that's already something you're thinking about in your bill. But I think that is, it's a lot of daytime appointments that not everybody has sick time from their employer to do. So that was just a thought that I had as you were asking that question.
RJ, I think you should just answer that. Sorry, Emily, I just see RJ.
I was going to say the same thing. Go ahead.
Yeah, I think that's what's so important about these discussions is everybody that are on these calls are the people that are there. They're seeing this firsthand. And that's where I've been driving this bill, is really from connecting with as many organizations, stakeholders, donors, recipients as possible. And that idea, I have not heard it yet. Do I love it? 100%. Right from that comment right there, I'm going to be moving forward to seeing if I can put something together and put that into the bill. So this meeting already has had such a huge impact already, and I love these discussions. So thank you for that input. I have attached my email on the chat. If anybody has any further suggestions, please feel free to reach out to me. I want to do everything I can to make this the best bill possible, to have a positive outcome for organ and tissue donation in our province, because it is critically important. It will save lives. So thank you so much for that input.
That is so exciting. That's fabulous. This is where it starts. Those conversations, the right people connecting, making, like, we know we want to get there. We know Alberta can get there. We got the leadership, we got the passion, we got the skills. It's going to be excellent. And Tracy is a living donor who went through the process, who again provides those connections and really being able to go through the system herself. I don't know if you want to add anything, Tracy. You're just on mute. There you go.
Yeah, I'm just unmuting myself now. I just wanted to say I really appreciate the opportunity to be a volunteer in the program. When I started, it was kind of new, and I've had some really great opportunities as a volunteer to speak to people on the phone, to just share my experience with them. When there was volunteering happening at the hospital, I was volunteering at the dialysis unit to talk with people about any questions they had about transplantation, or that, all of that. So yeah, I've really enjoyed my opportunity to volunteer, and I'd encourage anybody to both use the one-on-one program who has need for that kind of support, but also to be a volunteer if you have the time to do it. Thanks.
Wonderful. And we probably just have time to answer one more question. Donna had in, oh, there's another question now. So how do we match the people to the one-to-one volunteers and the registry information around that? And the other question from Donna earlier there was just about the access for other organ groups, including liver transplant, to the one-on-one program.
I can answer in regards to matching patients together with the volunteers. So with that, I do complete an initial assessment with the individual or the patient seeking support. And so I ask them questions about where they are along their journey, the type of support that they're searching for. So for example, if we have an individual that is considering a peritoneal dialysis, I would then learn a little bit more, see if they're wanting to connect with someone of a specific age range, maybe someone in a specific part of just their life and certain milestones and all of that. And so based on that info, I then just reference our roster of volunteers. So based on the criteria, unfortunately, we don't always have volunteers that 100% meet the criteria, but again, we just open it up. We let them know this individual might not fit 100% the type of support that you're searching for, but we can match you up with other individuals. It's just about opening it up, letting them know that they can chat to multiple volunteers. And so that is one way that we do it. We have had situations where perhaps we are connected to just families that are involved with the organization. Maybe they're not 100% formally trained for the program, but they are still open to chatting. So we have had cases, especially when it comes to pediatric children and caregivers, of reaching out externally to those individuals. So it's all about building community. I've been very fortunate to just get to know individuals and their different journeys and what they've been through, and just who they're connected to in terms of if they have a family member that's impacted, or what that looks like. So trying to build that community up as best as possible for the individuals that are seeking that support.
Thank you. Oh, I see RJ has to go. Thank you so much, RJ. And I agree with Irena. Sorry if I mispronounced your name. The testing on the living side, if again, resource would have to be added to this, but shrinking that testing window. We don't want it to be a year long. You know, we know that it can be done. So I'll follow up as well. That's the ways that we are pushing advocacy efforts as well. We hear the journeys like, why does it take so long? Can I just come? Especially if they're having to come from rural areas and testing can only be offered in the major centers. Those barriers, 100%, that's what we advocate and work to be able to, you know, support and improve. There was, oh, what about languages? Okay, so currently our Kidney 101 volunteers, we have English, French, and Spanish. However, we tied us in because of our virtual world. So they wouldn't be able to connect on a person, but we do live virtual because we have to until it's safe. Then we have Punjabi and Chinese as well. I am currently also trying to work with the Indigenous communities because I would love to have an Indigenous, you know, more leaders working with the elders, and also transferring everything that we do, not just the Kidney 101 program, everything to be able to impact and work on that population. So on those other languages, we work a little bit beyond our scope from our border perspective, but virtual ties us all in together. So yes.
Wonderful. Well, thank you so much for a fantastic discussion and a really great presentation. Just in closing, next week's ATI seminar, we're pleased to have Dr. Beatriz Dominguez-Gil presenting the key features of the Spanish model of organ donation and transplant. And of interest as well for tomorrow, the nephrology ground rounds is Dr. Sandra Cofield, who's going to be presenting on frailty in kidney transplantation at noon. So the links are all in the chat there. And thanks very much.
That's so great. Thank you so much again, and to the Alberta Transplant Institute for having us. And what a great session, guys. The changes are happening. We're going to push from all levels and we will get there. So thank you so much again. A pleasure. Remember, at the Kidney Foundation, we're behind you all the way. Thanks.